for everybody, especially you physical, you mental, you emotional, and also you spiritual aspect. Before we go further, make we look within God in word say inside verse 3 John 1 verse 2. It says, Beloved, I wish above all things that thou mayest prosper and be in good health, even as thy soul prospereth. Okay, so this program here, so they show for everything we concern well body, waiting you for do for make you get good health, for make you get well body. And we know say for make you get well body, you need for eat good food. And one parent food there, so I want to encourage you for it na cassava leaf. Before we go further, make I tell you waiting are the benefits them for cassava leaf. So cassava leaf is good for headaches and any type of pain you dey feel. Cassava leaf now one party leaf them way prove say in good for you where they suffer poison, you would go through poisoning. If you take cassava leaf, you smash them and you drink the water, then the poison they automatically they vomit. And then cassava leaf is good for you will get knee problem. You would go through knee problem. Cassava leaf good for that also. And cassava leaf they help, especially you will get diabetes. Cassava leaf now one part of things them that where you for turn you for add by your daily diet. Okay, so before we go any further, I want we get a video. We'll join Waterloo TT for making sure we how for prepare salon cassava leaf. Okay.
Plenty people like cassava leaf and oil. Before I say we got for you special oil where I pull come out from Benny, where wait man called sesame oil. Kusha and carbon me fambulem. Me na Waterloo TT. Today let we make cassava leaf and oil. That na cow meat, 2 cup ganat, ogiri, cowrie fish, 3 Maggi cube, the sesame oil and pepper and yabas. Now then here we get for use for cook the cassava leaf. This na 2 tie cassava leaf wey comot na me garden. I purposely tie and so for say e comot 2 tie because na 2 cup Ghana to get for use for cook am. Put your cassava leaf na bowl, loose the tie comot pan am, give am water, wash am 2, 3, 4 times according to how you feel say e don clear for you or e don clean for you. Wash am so that you go pull the dust and the sand comot pan am, and put am at the same bowl and start for pull all the thick comot pan am. Pick the leaf comot pan the thick, do am exactly like how they do and so, and set them aside. Now, the reason why to make you they do this that because the cassava leaf now also you they beat them and you no go want for let any thick dey pan am. Put them at the same bowl, allow her let drain water little bit. As it drain water, so carry it at the matter odo. Put them they beat them small as they go down you they add. As you they go down you they add. You see how this don't tell like I go can't add there now. Now so I go do and take a bit and done. Beat your cassava leaf done. According to how you feel say it don't smooth for you for cook, then you set them aside. Put your fish in a bowl. Get a lemon, salt or vinegar, whatever you can use for cleaning protein. Get them and wash them fine one. Me use for give me fish lemon where I dey wash them. If I not get lemon, I can use salt or vinegar. Take patience for wash them. Wash them 2, 3, 4 times according to how you feel say it don't clean for you and set them aside. Do the same thing for the beef. Put in a bowl, get water. Get your lemon, salt or vinegar. Wash and 2, 3, 4 times according to how you feel say don't clean for you. Do this and set them aside. Now we put on one small pot. Get a lily yabas and lily Maggi. For let it can steam pan in your water. As it begins steam, so we go mix and small so that the Maggi all go take shape inside. Mix them. Cover and let steam pan in your water. Then you come back now for can get other water so that it go boil fine one way it go soft. That be don't boil fine, it don't soft and I don't set them aside. Pepper where you don't pick then a matter odo. As it beat where you don't beat go far, you don't beat fine. Put your bass there. Beat and fine one and set them aside. Pot where then a fire now. Put clean water inside there. Not so plenty water, not so lily water. Put your granite. Allow let it boil. As it boil, you see all the granite don't boil fine one. So come in with your ogiri, you put on there. Me don't put me ogiri now. I don't allow let it boil. and I don't put me beef and me fish inside. I do this off camera, sorry guys. Now na time for let we put we cassava leaf. Beef and fish we don't go inside with lily salt for let go get taste. And now I don't put me cassava leaf and I dey put me oil. Get one Maggi. Allow am for let it boil. We go put the pepper where the cassava leaf still get water so that the pepper go boil. The reason why we dey put the pepper now for let get that special aroma. You understand? So now the balance Maggi we left when a 1.5 Maggi. Not forgetting that 3 Maggi we been get. Now all together we can use 2.5 because we don't use half pan the beef. Put your Maggi, you balance Maggi, mix them and see if you get taste. If you not get taste, whether na Maggi you need you can get, whether na salt you need you can get. Now we two balanced fish will be left. I don't add that now and I go allow this for let it boil so that everything go cook and done fine one. It not go take again, this spot go done. You see how the cassava leaf don't cook? It don't make fine and now cover them. It don't done. Give some time for let it done. Mion be done. And now you see I serve how it's fine white rice. Plenty. Thank you for watching me, guys. Love you all. God bless you. Like, comment, and share. God bless you.
Happy Waterloo Titi, the show we have for prepare we own salon cassava leaf. And we're gonna forget say cassava leaf in good for that in good when it comes to food poisoning and diarrhea and self-arthritis. That's not knee problem, you will get knee problem, and in the add your stamina and self in the man wound. Yes, that's what they say the master savvy people that say the man wound. So of course we know say February 4th is World Cancer Day. Now the day way that they look into the one that we get cancer. So we want for know waiting a cancer. Now one part is bad secret who don't they and self believe when you say you know get cure. But we want know waiting a cancer and waiting can cause for make person get cancer. So we want for join the masters I will put to them for me then say we waiting a cancer.
Hi, I'm Elizabeth Dexter. I'm in the Department of Thoracic Surgery at Roswell Park Comprehensive Cancer Center. We operate on lung cancers and esophageal cancers and tumors of the chest wall and mediastinum, which is the middle of the chest. A lot of people who develop lung cancer are smokers. 90% of lung cancer is associated with smoking, so many of their symptoms are overlapping with things such as emphysema or COPD, pneumonias. So things that they need to pay attention to are things such as cough, unwanted weight loss, new hoarseness, chest discomfort. But again, many of these symptoms do overlap with their other symptoms of their other diseases. But if there's a change in symptom or something gets more frequent or more pronounced, that's something that they may need to pay attention to. We recommend that patients at least touch base with their physicians who are familiar with them to see if they think that they need to be seen in an expedited fashion, because maybe it is something that the physician knows that this is unusual for them, and they'll help them decide whether they need to be seen sooner rather than later. There are currently screening studies that are going on for people who are, for instance, have a strong smoking history, and sometimes these can be things that are indicated for their physician to start getting some screening CT scans, for instance, especially if they're having new symptoms or worsening symptoms. Some of the symptoms that mean that you should see your doctor sooner than later are increasing fatigue for usual activities, things that used to not make you so tired, such as your household chores or going running errands, definitely things like fevers, chills. If your appetite goes down and you're feeling like your eating is not on par with what it usually is, and you're losing weight, that's definitely something that needs to be looked into. And if you're developing something like hoarseness that you didn't used to have and it won't go away, or even if it comes and goes but it persists over a few weeks or months, that's definitely something that should be checked out.
Lung cancer is the #1 cancer killer in the United States. It kills more men and women than colon cancer, prostate cancer, and breast cancer combined. Unfortunately, all you need in order to get lung cancer are lungs. So there is a highest risk for developing lung cancer. Those are individuals with heavy tobacco exposure. But really, 20% of lung cancer is caused by non-tobacco exposure, and that includes the environment and genetics. So some symptoms for lung cancer are oftentimes generic or non-specific. So that includes a new cough, a new wheezing, coughing up blood, shortness of breath, and losing weight. Unfortunately, the majority of patients who are diagnosed with lung cancer may not have symptoms. But we do know that for patients who are at highest risk for developing lung cancer, heavy tobacco exposure, we have something now called lung cancer screening with low-dose CT scan, also called a low-dose CAT scan, and that definitely saves lives. There are millions of people who are eligible for lung cancer screening. Unfortunately, of those people in the United States who are eligible, only 4% get screened. Now you compare that to mammography. So for women who are eligible for breast cancer screening, 70% get mammography. So that's a huge gap that we have to overcome. So if you think you might benefit from lung cancer screening, then talk to your doctor and ask, should I get screened? The diagnosis of lung cancer does not mean an absence of hope. We have many treatments here at UC Davis Health that works with our patients and their families to fight lung cancer and to bring our patients back to the lives that they want. Those interventions include tobacco recovery and tobacco cessation programs, innovative surgery using robotics to remove lung cancers, and a robust plethora of clinical trials that look at things like precision medicine, personalized medicine, and immunotherapy that boost your immune system to fight lung cancer.
Immediately consult your doctor. Lung cancer may produce pain in the chest, shoulders, or back, especially when breathing deeply, coughing, or laughing. When lung cancer causes chest pain, the discomfort may result from enlarged lymph nodes or metastasis to the chest wall, the lining around the lungs called pleura, or the ribs. Next thing you should check is the bone pain. The lung cancer that has spread to your bones may produce pain in your back or in the other areas of the body. Bone pain is often worse at night and increases with movement. Other symptoms you should check are the recent headaches, loss of appetite, facial swelling, and feeling tired or weak. People who have smoked have the greatest risk of lung cancer, though lung cancer can also occur in people who have never smoked. The risk of lung cancer increases with the length of time and number of cigarettes that you have smoked. If you quit smoking even after smoking for many years, you can significantly reduce your chances of developing lung cancer. Alright, so that's all for today. Hope you liked this video. Don't forget to like, share, and subscribe to our channel. Thank you.
So for we make our work come down to we within a cancer, saying inside our body them we made up of cells, right? And then cells them also can reach a particular time where then for die off and then new cells then come up. But there are certain cells where it can be stubborn and say no, I need die. Yes. So when the cells then decide say no, then they die, they can continue for multiply, they can continue for reproduce themselves until they eventually turn to a tumor. Now there are two types. They get one them where they stay one side, and it just fold they probably in your colon or somewhere along that, right? Like it just stay one side. It's not so dangerous. It can be cured with immediate effect, but I will leave it to the masters of people them. And then they get the second one where in a mining business in the old side they go and waka waka. Now that one when in the mining business now more or less very dangerous and they cause the cancer. So we don't understand now it's not cancer. So let's see different types of cancer. We get breast cancer, where of course usually most times and they happen to widow women them, where you understand it happen at the breast of the woman. And then we get lung cancer, where Master Sabi people they don't deem say a very or probably is the most dangerous cancer, because it affects the lungs, and as a human being you just need to get lungs for make you get this particular cancer. Yeah. So and it's so dangerous that possibility for make you live can be very slim. So we think it usually cause this is usually exposure to tobacco, especially tobacco. And when they eat healthy foods, like how I start for make you get well body, you need for eat good and healthy food. When saying they eat healthy food, you they eat more of the imported canned foods, then processed foods, that can even injure your lungs eventually. Yes, so we get lung cancer, and then we get prostate cancer, where in most cases can happen to men. Yeah, it can happen to the men. And then we get the colon cancer. We get colon cancer, and then we get the leukemia. Okay, so cancer a really bad sick, really deadly sick, and it can get a whole lot where it can do to the human body. It can come up with different sick where you says I know go think say you go get, and it can be so minor you not go even think for take to that serious until eventually we don't see don't pay go on now eventually, and then you see it shoots up and you're like, okay, this is serious, I need to take this serious, I need to go for treatment and all of that. And in most cases the treatment can be somehow expensive, because you have to go through chemotherapy, you have to go through, sometimes it can even result to surgery, and in the cases of breast cancer sometimes past even cut off your breast. Yeah, sometimes past even cut off your breast, and at times past you even they live on medicines. Most times sometimes they even live on medicines. There are times if you don't even take the medicines or go for the treatment, then they think can get worse than you, which is why as human say we health, we for prioritize we health. We can usually say, well, but in a gentry, health is wealth. If we not get good health, then we are not really enjoying our wealth, you understand? So it is essential for us to keep going for checkups. It's essential for us to keep checking our health, making sure that we are in good health, eating good food with nutritional values, not just for eat good food because it's expensive, because there are a lot of food out there that are kind of expensive but the nutritional value not really did right? If it's really essential for me going for food them we get the nutritional value, because that's why you are eating them. It's not because of it should be expensive or not, understand? So as I was saying, when you eat them good food there, so they eventually help your body for making grow, and you cells them for me then go through the right process and the right channel. And also make sure so you go for regular checkup. If you see slight symptoms or something where you think is abnormal from your regular health base or your regular health routine, you say this is abnormal, it's essential for make you go do checkup, because it could be more serious. And the earlier you spot whatever it is that is happening in your body, the earlier it is that you spot them, the earlier it is that you'll be able to deal with them, and then for making it result to something more than you can handle or control in the later end. Okay, so before we go any further, I want to make we go for a quick break, and then we'll be right back. that you spot them, the earlier it is that you.
Brainy Dose presents 10 amazing health benefits of ginger to improve your life. When you first think of ginger, you probably think of those gingerbread houses during the holiday season, or maybe ginger ale, the carbonated soft drink. But ginger is a popular spice with some powerful medicinal properties. It's become well known for its many health benefits, and people around the world consume it for this reason. In this list, we explore 10 amazing health benefits of ginger. Number 1. Helps manage blood sugar levels. Researchers have found that ginger can help keep blood glucose levels in check. This is very important because these levels have a direct impact on weight loss and weight gain, as well as how energetic or lethargic you feel throughout the day. If you've noticed that you're feeling that midday crash, it's most likely because of your blood sugar levels. Adding a little ginger to your lunch can help you stay focused and on task. Think of ginger as an all-natural alternative to those energy-boosting products like 5-Hour Energy. Number 2. Relieves gas. Some people just let it rip, regardless of where they are or who's around. But for most of us, gas can be embarrassing. There are many anti-gas products on the market, but it's always best to try the natural route first. You can try ginger tea. It's easy to make and it has been proven effective at relieving gas. Drink a cup of ginger tea before you go to sleep, and the magic should happen overnight while you're sleeping. It helps clear out your digestive system and neutralizes the problem from inside. Number 3. Weight loss. Maintaining a healthy weight is one of the best things you can do for your overall health. Being overweight can lead to many problems, including heart attack, stroke, high cholesterol, high blood pressure, diabetes, and even cancer. If you're on a mission to lose weight, adding ginger to your diet will help your weight loss efforts. Ginger is a natural ingredient that can be found in many fat-burning supplements. It can speed up your metabolism, leading to calorie burning. It can also help keep you feeling full longer, reducing your overall calorie intake. Number 4. Boost nutrient absorption. It may never have crossed your mind, but when you eat a healthy meal, your body doesn't absorb all the beneficial nutrients. While the range is quite broad, your body will absorb somewhere between 10 to 90% of the vitamins and minerals in your food. Nutrients help signal your hormones to let the body know when it's full and keep your fat-burning system working at optimal levels. If you're looking to improve your health in general, and perhaps lose weight, you'll want to absorb as many nutrients as possible, and ginger has been known to boost nutrient absorption. Number 5. Improve circulation. Ginger helps thin blood, improving your overall circulation. As ginger improves your blood flow, it can create a warm feeling in your body, and this is one reason why people enjoy ginger tea on those cold winter days. Number 6. Pain relief. Before you reach for a typical pain reliever like Advil or aspirin, try ginger first. Regardless of the type of pain you're suffering, ginger acts as a natural pain reliever. It even fights inflammation that can cause aches and pains, and works on a hormonal level. Consider starting your morning with a cup of ginger tea and see if you notice improvements throughout the day. Number 7. Improves your breath. Maybe you have a big date coming up, or maybe you don't. Either way, ginger can help improve your breath, and having fresh breath is always a good thing. It's best to eat ginger toward the end of your meals so it can cleanse your palate and leave your mouth feeling refreshed. You can also mix some ginger with hot water and drink it. It's a great way to flush out your mouth and neutralize any bad taste, like the dreaded coffee breath from drinking coffee. Number 8. Boosts immune system. If you seem to be battling with frequent colds, chances are that your immune system is weak. Your diet plays a large role in making your immune system strong or weak. Adding ginger to your diet will help in keeping your body's defense system strong. Doctors say that ginger helps cleanse the lymphatic system, flush out toxins, and kill bacteria. Number 9. Clears sinuses. Whenever possible, it's always better to go with a natural alternative rather than over-the-counter drugs. Try ginger first. There's an active ingredient in ginger that has proven to work wonders on the sinuses. It helps unclog your sinuses and facilitate drainage. You can brew a nice hot cup of ginger tea to reap the benefits without the use of any medications and their possible side effects. Number 10. Fights cancer. Chances are you know someone who is battling cancer. or maybe you're fighting it yourself. Several studies have found ginger to be beneficial in fighting lung, prostate, ovarian, colon, breast, skin, and pancreatic cancers. According to researchers, ginger's anti-cancer properties are a result of the compound 6-gingerol, which is found in large amounts in raw ginger. 6-gingerol has antibacterial, anti-inflammatory, and anti-tumor activities. By simply adding ginger to your diet, it can help prevent new cancer cells from forming and destroy active ones. It's also beneficial for people who are already on cancer treatments, since ginger has been known to prevent the toxic effects of cancer drugs. After watching this video, you should have a good understanding of the many benefits that ginger offers to protect your entire body. The next time you're at the food store, remember to pick up some ginger root and start adding it to your daily diet. Just note that while it's rare to have an adverse reaction to ginger, herbalists suggest that you keep it under 4 grams per day. Also, be sure to look for the following when you're picking out your pieces of ginger. The ginger should be firm to the touch. The bigger the piece of ginger, the older it is and the more pungent its flavor will be. Look out for discoloration or soft spots. Whether you want to use it in your cooked meals, drink it as a tea, or press it into your fresh juice, you'll be able to reap all the amazing health benefits of ginger. Thanks for watching, and thanks for subscribing.
So that was 10 benefits of ginger. Let's go quickly over it. We get controls your sugar level. Of course, this very essential for especially people that want to go through diabetes and stuff. And then it help you relieve gas. Okay, they help you fat spine. Exactly. And then it help you get weight loss. That is, if you want to reduce your weight, you don't want your weight. Ginger very good for that. And you will take ginger, make sure say they help you for make you get absorb the nutrients them, and it help for make your blood circulate very well and effectively, and now a good pain relief. Like if you feel pain, ginger good for that. I know, cause like when it comes to cold cold and one for the bites in the way they actually bring pain, especially joint pains them. So ginger fine for that, for cold and also for pain, especially joint pain them. And it declines sinuses that are like way blood or something they run from your nose. Yeah, so ginger good for that. And one part of the most important thing we list out the most important, or I don't know if it's the most important, but one of the best, especially related to the topic today, is that it fights cancer, right? So that's the last, but it's a good one. So ginger actually defeats cancer. Not mean say you go for go chop past 3 ginger and then you say because you want fight cancer, you want get good blood circulation or any of that. No, you need for one back, like how doctor can prescribe tablets for you need for also no say even when it comes to food with medicinal food or medicinal value, you also go forget a prescription, because if you don't get a prescription you just take it like that. That's also an abuse. Okay, so we Master Sabi person and a doctor don't join me at the studio for come tell me more about cancer. So yes sir, you can quickly introduce yourself to some of them out there.
Me Dr. Joseph Eke Kamara, and the CEO and founder of Sing Some Medical Services.
And a big man. We see is CEO. Yeah, introduces them as CEO and a big man. Please, now Master Sabi person this. So like they go with the topic cancer, and we don't briefly explain about cancer, but if I could get a Master Savvy person for deliberate more about cancer, for make even the layman out there go it will understand say this na cancer.
Well, we all know the under everybody's word.
Yes.
We know to the extent at which this thing done the embark with society. Before Natiwe be you know the area and so. But of late we say this disease don't become an epidemic.
Yeah.
You understand? Cancer not just abnormal cell. We didn't say abnormal cell. If the cell in shape be like so, in decide for take a different turn, then it continue for divide, and it produce bad chemical substance where they destroy your organs that are your body. It be now the liver, the intestines, your breasts, many parts of your body.
Okay,
Yeah.
so we don't briefly watch about the types of cancer, because we don't understand, say, not to one kind of a cancer we get. You know, when we get what I can say cancer, one or if it all the organs on a specific organs them can be vulnerable to cancer, or then abnormal cells there. So is it that there are specific organs, or like all the organs they just vulnerable like that?
Well, the cancer depend on the various types.
So
if you affect your eye,
okay. Okay.
you get retinal cancer. Where we say you see some people in the eye, one part of the eye big, they swell, and a cancer back. If you affect your gut, you get colorectal cancer, where you see some man in the toilet blood, he vomits blood at the same time. The way they toilet the blood, you say in stool the black, and a colorectal. They don't affect your colon, they don't affect your rectum. You toilet the blood, just like we didn't say a pump poppy. You understand?
Okay.
So man toilet, they full up one bucket.
Wow.
The blood, yes.
Yeah.
They become weak, lazy. You know, they even able to walk and talk.
Well, obviously, we
Colorectal.
don't go through that. You don't.
They get cancer back when the blood being it affect what they call leukemia. Where now at the blood being it try for finish by body.
Okay.
Let's say them put 10 pints blood or 10 units blood per body. Inside one day all they done. So you see, so it depend on the area we target, yeah, and it depend on the habit, the source of habit. Normally the cancer they meet we based on we habit, which we pull them from.
Okay.
Like the way they smoke too much, it gets that way they affect when are the lungs. Yeah. You go see some man we get cancer of the lungs. If you sit down yourself, it blow you the area. A cow sit down so the way they whistle.
Okay.
Like some man archaic per smoke. Sometimes you say for me baba for more 15 years where the bluff. Say for more 15 years. I smoke cigarettes, so I don't think say go make. If you see you come be where cancer affects with the lungs, you go afraid instantly. You go say now stop for smoke. Yeah.
Okay, but I want to know, with the kind way how you don't describe cancer, so it's very, very deadly, like in a bad sickness.
Very deadly. Because
yes.
you know
So we want to know
the
if chances for me person get anyone having cancer there, so in any way or form, is there a chance for make them survive, or like they can get time frame for survive, or like they can continue for live?
No, the only thing is when you get short disease, we get the early symptoms, you stand a better chance for 100% heal from cancer.
Early symptoms.
Yes.
So
colorectal cancer, if they don't check them by you, something you go feel an ulcer, you feel an this, so then check them. You understand? Then you will cut the side way affected.
Okay.
And during the gut, you still survive. You understand?
Okay, but you say early, so
Cancer.
what if not late?
No, if you late, then are you carelessness. All the thing we come early, you better sometimes remedy go day. You know, especially parts of the body where na two. If na one is affected, if you get 2 kidney, na one is affected, they pull the one, you survive with one. But the liver you own way affected. Likewise the blood. So you see, so but we get them early. Sometimes even at the eye, then we say, okay, we more remove the one eye, more replace the other one. If you reach that peak, we not reach inside some parts. Then the womb, you know, some man can get cancer of the womb. We at least in early stages, then can remove that womb there, then the patient survive without womb. So always the early stages, the onset of presentation, we count unto the doctor early. It protects we, and sometimes we habit. If we tend for minimize, we to the eat, we to the drink. You know, cancer of the liver, 70% of the one that we get now people already drink too much alcohol. So you see, if you say now, me, because I don't read this, I dey left for drink. So the chances for you don't limited, you understand? And most of the area, sometimes environment can too dirty, pollution, you know, then smell how they smell, they inhale bad substances. Sometimes can get a particular thing the way they cause them, carcinogen. Then are the chemical, you understand? So if you inhale a large substance, it lead to, you know, no party to go sit down. So that.
Okay, so I want to know, like, is there like an age for me person be vulnerable or exposed to cancer? Like, for example, let's say sometimes picking with it 10 years or below not to get cancer, or possible 70 to 76 not to get cancer. Is there like an age where person they become open, say, okay, I'm vulnerable to cancer?
Just like malaria, we mosquito, you know, answer beef now 1 year on a 1 day old baby.
Okay.
It is better, right? We they see mosquito, it is better 1 year old baby or 1 day old baby safe. You know, I know. That's so cancer day. You know, it depends. Like I say, it depends on the case. You understand? We habit them sometimes. None of us say cancer specific. Say nah, this particular thing they cause them. You understand?
Yes.
It can come up from the thing they what they eat. The especially some of the food stuff.
Like they say that canned
then
food,
sausage, then canned food, then processed food, then
yes.
meat. Even the plantain self way we buy in a street, we don't burn too much in a fire.
That we don't burn.
Say, you understand? And that brown one way, if you say, this way brown, so now like that possible sauce. You understand? We microwave the way they use until they use plastic sometimes to put her inside. We don't know waiting for use na microwave. You know, all land they contribute to that particular substance that is very, very, very much teratogenic. It affects your DNA. So you see.
So speaking of DNA, I want to know if this whole cancer stuff, is it like
generational?
Well,
no.
What of, let's say, probably the mama be get the picking belly and then cafe not saying get cancer and then give.
Well, they can just explain. They can just explain. It can influence your DNA because of the chemical. They don't come inside you already. You understand? Maybe if you born picking, maybe the influence, you know, start early, but sometimes if maybe after 10 or inside born picking, sometimes you still can get that breast cancer. Depending on that particular substance. But not too, because the sources, you know, you hardly ever say the papa gets a die of cancer of the lungs, so the bubble back die of cancer of the lungs. No, you know, because when as something we get them from bad habits, if they smoke too much, then the bubble say well, I need smoke too much. I don't think say
it's possible for make
no, get the because in papa they drink. So we born like himself. As yourself can begin drink like your papa. So you go die like your papa, right? So that now the habits will just change.
Yes, we just change the habits.
Okay. You break the trend, yeah.
I should say I'm putting the okay, so like waiting at some of the early stages then where person go able note say, okay, I need to go check myself. Make I know.
Like the one the more as you say the Hamburg winner salon, you see like the breast cancer. We normally, well, mostly come sometimes we born. You know, you can see some fluids sometimes they come away abnormal. You know, you go see sticky, you go slimy, you will get some bad odor. You see sticky by your brazier, then thing and they all the signs. You understand? Say okay, now check well human clinic, now check bar. You know, and sometimes you man, if you wake in the morning, get a normal exercise for lidom, and just feel your breast and see. Exactly. Likewise, men, but men is not common with us. Yeah, because if man can get bobby, they can't get breast cancer. You know that laziness. Because at least when you check, you see say abnormal lump there. We know say if I quiz they feel slight pain. It's not normal. Like the other one, you understand? Prostate cancer for men, you don't reach age 40, 50, 55 latest. If you see say you don't reach that age there, you not get no complaint. See doctor, then test you for prostate. We call one test when they call PSA, they do on a clinic. For check.
Wait, hold on. Make I get an understanding. You there around 40 to 50.
Yes.
And then you know get
You
no
not get no complaint with your rectum or your rectal area, like where they wet, Then just check. Because now the stages, then the more women they get prostate cancer.
Okay, so you supposed to get complaint
No, you not forget complain, but as well for put you
in a safer
that lesser
position.
risk. Yeah, for say, hey, if I can't get her now, we need to do surgery, because normally after 60. You just get for bear. You can see some doctor and say, well, we're not going to do any surgery, so you bear until you die. So when it's nice for bear at that age, you check, say you not get that cell day or that tendency for no get out, And sometimes you man, if you don't see, say you don't wait fast, you reach that age day, and you urine uncontrollable, and sometimes you get painful urination. Sometimes you're not able to evacuate all. The rectal area, you waist bone, they feel too much pain and uneasy pain. Understand it? Now probable cause. So like, if you try for calm, let them check them at an early stage, because all things get signal. Yeah.
Yes.
Then you self the complaint say you get gastric ulcer. They complain always gastric ulcer, and maybe one day you go toilet, you see blood with your tissue. That self na bad signal. Report. The quick go toilet 110, 210, you see blood. That for no say yes, because cancer of the colon, na blood you dey pull.
Wow.
So
okay, so you put out first half.
You dey vomit blood, all landing a signal. Not just take mercy, cold, they say they go again. Go in and check you, then do endoscopy, then know which area affected. At that early stage, you will survive. You see, cancer of the skin. Will they use all kind of products? Yeah, they mix up do this.
Yeah, it's mix some,
So you want bleach, you want black, you want all white. Sometimes, when you don't reach a time where you say your skin, they pull some dots, them we don't even know. White dot, pink dots, red dots. You see and say, you don't try to
oh my God, that's why we give people a
try for check. Yeah, your body they combat.
Yeah, combat.
So
that's the word.
So that back na bad signal. If they pull some rash, you say all day they itch. You don't treat that itch is there. Try for see doctor for that. You understand? You so na that cancer of the throat. Sometimes you see some man invoice just the loss.
Okay, take us in a cold.
Yes.
Like most time, okay, take us in a cold.
Yeah. You hello. I did do. You see some people and they don't know. Say na danger.
Wow.
You don't do on alcohol for over 50 years. Then you divorce. You want call your sister, you want call brother, say hello Kamba, that kind of sound, it's dangerous. You don't try for treat and that operation, they're very expensive. It's over $10,000-$20,000. So imagine that kind of case that you get up in a salon, would I go pay that kind of money there? So why stop for drink then? Danger then substantial where people in the take. Even then kush, the other thing, the way they pass through that throat. Not if you say we smoke, the inhale, they pass through the throat. Outside go affect the lungs back. So all things risky. You ear passages all get tendency forget as sick day.
Wow.
So you see, these are the basic.
And you sabi the most interesting thing about all these, the symptoms them in something where we can take so common that the moment we see we go buy tablet, we go buy this.
Cold. It's not severe cold.
Yeah, it's not cold. And then we take anti-cold, we take this, we drink
ginger nice for the boys and good for.
And then the moment we see so we don't recover, we say, okay, I'm fine, I'm good. So I don't need
after
to
1 week back, it come back. You go say now buy only. Yes, okay. These are things where if you normal, you take that. It's good for prevent. Prevention is better than cure. Prevention.
But if you already did it, then it's dangerous.
Very dangerous. But if you did, at least you start and you stop. At least you don't stop that rate at which you for increase. You understand it? Then don't can diagnose you for this. But the first way for do not stop first, man. You understand? But some people like the more say, now God they kill, now God they story die.
Okay, so Pamela, the one thing where I'll make you take home, if you say you don't get a particular symptom or a particular sign, consistently you take this cold and then abruptly come back, take something cold and then abruptly come back. The best thing,
especially bleeding, you scratch your skin self, you scratch until you see blood come out,
and then
you heal. Your skin don't become so light, it bleeds, then So a lot. We get 14 types of cancer, but the basic one there, I think, are like 6 where they affect renal salon. Yeah.
I want to go see doctor. I'm master. Some people they tell you so. So anyway, if I'm with them, before we go any further, we'll go for a short music break, and then we'll be right back. Don't go anywhere.
Okay.
For you, just the join you don't kind of miss a lot. Yes, you don't kind of miss a lot, but we won't go further because of time. So Mr. Joseph, one thing will be catching attention on the internet these days was that King Charles III diagnosed with cancer. They don't really specify the type of cancer, yes, but for a guy of such, caliber, age, especially we're looking at age here, what do you think that the tendency for treatment, one, and for survival? Is it that such people, especially in that old age, they go for live the rest of their lives on medicine and all the stuff, or then go for undergo through surgery or stuff like that? You understand it? Especially in that old age, like I even talk about prostate cancer. So what do you have to say about this?
Well, mostly with men, they like the kind person diagnose, just talk on waiting down, or prostate cancer mostly with men. It must be one of the reasons. You understand? I cannot conclude. You understand?
Yes.
But men with that age, if they're not detected early, most times they're late. You understand? And with that stage, then we not expect say it will do surgery because it's fatal. You understand? Not all man can survive. Okay. So men, the idea that we then get say you don't touch that part of your body. Trust me, you rather give up. So too bad.
Okay. Too bad before that man.
Yeah. So I make most men at 60 we touch just go say now prepare for me my mind. I mean daddy in that one because they always don't feel left out. Just like say me I don't think say me na man again. Okay. That thing they depress them, they go into depression. So now that can happen. You see some man not get pressure, being get pressure. So all that the complication just increase. So you see so but it better you get money, you get cancer, I don't get money. I tell you like Prince Charles, in a of caliber man. You get in a way go make you feel lively. Sometimes you go just travel out and say I die in money. I can don't send me money. I you can see the best. You hire the best specialists in the world for manage you. For now it is a control measure than they do at least. But for say we don't know about any treatment right now where people will say you take you take malaria medicine, say they're well 100%. No. So if you get down this safe, if you don't afraid, if you don't know down this safe, if you don't afraid then where they affect with organ tissues then. So you see so if the man like Dandy get Dandy, you go expect say in chances for him for survive with things in the next 15 years very high compared to Saloma and get same cancer in there. We no get money. You understand? That chances for them survive inside that village there with within the apparatus the way they use, within the I mean things them way medical attention we go get for make it survive for over 5 years. No. And sometimes when you see get an upline and say a witch.
Exactly.
So they don't forget what you for.
They don't abandon you.
I tell you, just like where you see you go to a village, you see some picking and belly big, you don't know say na cancer of the liver, cirrhosis. They say na witch, na devil.
You
First
don't-
they
you
we
don't
small,
swallow-
we
you
dey
don't
see
swallow
that.
witch beef.
You know, we always feel say na true. Until when we self don't come now, we don't learn say, then this na bad water. You know, the water that we didn't drink upline. You know, possibly in that village, yeah, now you don't toilet, we get the sick. In can drink and down na this other village now. It gets the lava, the lava, they get affinity for the liver, I go catch it. Again, that sick day, they will say na witch. So we see, well, our habit, hygiene they cause a lot in our country. You know, imagine you dey cook, you just come on. Now we latrine, that's what we call her. You know, you don't get way for can sanitize your hand. You go church food, your fingers they all look at the long and dirty. You know, it transmit infection. And then thing they can see no journey. They any side way hygiene no day. You understand? You did it.
Okay.
So you see, so they pass through a lot of things. So you know me say cancer na free trade number one.
In the outside,
Yeah.
But like how you say it better make you get money and then you get cancer. Chances for me to survive.
You go live small.
So what's in the happen now
environment.
to, let's say, we're not in a village, but we not get money, we can get cancer. Is there a solution, or is there a process, or has the person undergo surgery direct?
If you think may take surgery, like liver, I tell you say we get an salon. If you remember about now, I then $20,000-$30,000 if you do an India or any other side of the world.
I think that is one as a
Liver transplant. We're not ready for sacrifice the liver first.
that's the thing.
Would first we will sell your own. And liver now we see the seller, you know say you die. I ready for make me people and better sell $1 million. Yes. You can see the internet where people and they make that thing, but it's not a fun.
I don't know. Maybe if I'm putting it out there, probably first go to the week one selling liver.
Oh, but the operation, you know, they are salon in do for you. And then a highly specialized surgery that they will take hours. And so not a small money. So like it better you know, even members if they got push their sick then they from we
far.
For say safe you want to make your family and sell the whole sell all team for that menu one green. We all are picking and go for go school. We just say, but you won't forget about you. I guess
so. But anyway, you get any advice to family them out there, especially for prevent this cancer? Like
the whole thing is, we need to appreciate God where they are alive. You don't get no sick.
Yes.
My brother and sister, like I can talk. When God bless you with good health, like say you don't get food. You do upline, tell God thank you.
Thank God.
Let God not make any one parent sick here affect you. You will really want to say, hey God, why me? And which of God, you will still praise God because sometimes your condition better pass the other one. Yes. So you will get them safe. You need to thank God because you will exist for 5, 10, 15 days or even 1 year. You still a manager. You understand?
Yeah.
And some people can just start for the diagnosis, but after good prayer or deliverance, you see, pop,
and faith.
Yes.
Yes.
You see, you just disappear. The side way they make that kind of way with that tendency, all lost, redness, all disappear.
Yeah.
You know, it's just like a magic. But at least when you get faith, it happens to you back. You need to tell God thank you more than ever. Yes, because you know waiting than if you know waiting than they mean, you know, it costs you a lot. Where you pull away, you weave away from you know. So we advise is we hygiene, more limit on we food stuff. Sometimes we eat sausage, we eat this, all the meat, all the thing that when you go supermarkets. When you are wealthy, you feel say all thing. Well, you don't see
the same thing. What they say, I say
I eat all thing, cheese, this, all thing.
Nutritional value over expensive food. Not because they're expensive, means say you get all the nutritional values them.
Ham and bacon, this
exactly. Especially then canned foods them the supermarkets and all.
Whereas God give we natural foodstuffs we okay for we
exactly.
We others in the defend and they no get her. We tend for the go back and go waste. And you go waiting can imagine, waiting I can imagine. You go see some of the rich people themselves, they don't become moderate. Now the one that we just get money now, they don't become very chara. You understand? Because some of the man that get money now, they know they shy away from that kind of lifestyle. You understand? Then they go into natural fruits. They see them buy fruits, vegetables, always they now, and then food stuff, then fridge, they all don't change.
They know.
But we will just carry sell no more. Don't begin get 1, 2, 3 years. We don't begin go to supermarket. One buy all the meats that inside that freezer.
Expensive.
Whereas the manager will get the supermarket, know what it is. Yeah, you know what it is. Well, most of the things that they cause with that, they're not streets. Now we say they buy them. You know, we say they buy them. But it all depends on the mindset. Say, okay, can I just leave this kind of stuff? Now just begin for eat fish. Now begin for eat natural veg and all that stuff then they. Now just embark on change my diet for a while. Now see, you know, you live longer.
Exactly.
Than way if you say meat not the only source. You know? Yeah.
Okay, so thank you so much, Dr. Joseph, CEO of Sing Song. Now, big man, this. We want to thank you for we can share with we your knowledge, especially concerning this. I sure say people them out there don't learn a lot about this cancer. So this na sick way, you know, for play with, especially if you don't get money. Exactly. No. Especially if you don't get money. So people that are out there, you need to take care of your health. And one more thing, make I just go over certain points then we will note out. Number one, if you see a certain symptom or certain sick or something, they come up at intervals or at a particular time, and for make sure you go for doctor. Not just take anti-cold or whatever it is that you take, and then you see saying better for that time day, and then you just over it.
Yeah, if you bleed something, you want to take something. Yes. And most times you really get pile, you lead with bleeding because these are the initial stages of colorectal cancer. Yeah, most of them we get pile, they go toilet, they pull blood. Sometimes the blood is small. Seek medical advice immediately. You understand? Yeah. Because sometimes they can just manage that case, that rectum day. You're very delicate. Let the doctor assess them and prevent you from falling into colorectal cancer. Exactly. Yeah, because it don't so common. That's So then with food stuff, especially your diet, for prevent hemorrhoids, that we call pile. You know, if you don't see say you belly, you always they eat. Sometimes we like for eat cookery in the morning. You understand? Change with diet. Say okay, now left for eat rest in the morning because constipation. Now one of the causes where the tear the rectum day. Always you are eat and the ones the cook room and put the crow, the last crow on the pot, never put inside. You know, at the end of the day, you belly, you go toilet, you pass you only the iron. Yeah, for pini. And that pini, the first rectum they come out. They come out with force. And most of them stuff here, them bone the way they cham, they help for tear that rectum they with the puller. So they bleed. And imagine you begin bleed, that's so they know the well.
Especially because in the from the inside.
You know the well easily. So you get chances for destroy your colon. So if you're in that kind of state, seek medical advice, please. Because you get chances for survival. Yes. From that sick, yeah.
That's good. So make sure say you go see doctor. Number two, make sure say you choose healthy food over expensive food. Also because food expensive, so you get all the nutritional value. Choose healthy foods. And then number three, make money. My brother make money, my sister make money. So anyway, thank you so much for joining us today on the program, the wellness program. It's been wonderful having you here for our first episode. You can continue for joining me every Wednesday from 4 p.m. to 5 p.m. on Redeemer Television Channel 25. And today's program has been wonderful. I enjoyed having you on board. Thank you so much for being here. And until next week, I have been your host and anchor, Shali Rosalia Williams. Thank you.
Thank you.
Thank you.
Thank you.